I am Patricia Matto, the Vice President of Medical Education, Director of Student Medical Education, and the Regional Dean here at Southeastern Health. I graduated from the Lake Erie College of Osteopathic Medicine, and over the last decade I've been a Program Director for Family Medicine, as well as the Director of Medical Education, as well as the Director of the Traditional Rotating Internship Program and the Director of Student Medical Education. We have residency-run clinics, internal medicine and family medicine, and in these settings, the resident is primarily in charge of the patient encounter as well as documentation with review with the program director or the clinical preceptor. Your care will be mostly face-to-face with the resident who has experience with clinical skills that they develop throughout their student time at the medical school in addition to residency. Residents can fill several roles in the institution. First, they provide direct patient care. In addition, they serve on committees within the hospital structure, and also they can participate in quality projects and other research projects that the hospital has that's pertinent to either their level of interest or perhaps something that is a process improvement plan that the residents can be very helpful with developing. When you see a resident in the office, they have had some limited clinical work through their time in medical school, and then as they proceed to the clinic, they've had opportunities to rotate on several services, including cardiology and pulmonology as examples. They're better able to meet the variety of needs that a patient can present to them in the clinic, whether it's their diabetes or maybe it's an asthma exacerbation, by rotating through several services throughout medical school in their clinical years in the third and fourth year, and then gaining that experience as well as a resident. They bring that experience. In each of the clinics, we have an assigned, and sometimes two, clinical preceptor who will oversee the residents in the office that day. Anywhere from the first year resident to the third year senior resident, that clinical preceptor serves as a resource for that resident. Many times the preceptor does go and see the patient themselves with the resident, so there's combined learning, but there is direct supervision in the clinics at all times, and even our senior residents serve to mentor and help supervise the junior residents as needed. We attract residents to the Lumberton area and Southeastern Regional Medical Center that are community-minded. Many of these persons want to practice in a rural area and provide a full spectrum of care to the community. So not only do we have those that understand the needs of the community, but we also involve them in the community, and we hope that they will remain in the area after graduation so that we can have them on medical staff, and then they in turn can train the new residents and even our students that come into the program. So the residency programs here at Southeastern Regional Medical Center have been in the planning stages for quite some time, as we're affiliated with Campbell College of Osteopathic Medicine. Starting July 1st in 2015, we took our first residency class from an excellent pool of applicants. Residents are assigned a preceptor and they rotate through several services in the hospitals as well as get outpatient or clinic experience in their own offices under the direction of the program directors and other continuity clinic preceptors. We then continue to recruit, and we will have new classes of residents coming in on July 1st. Campbell College of Osteopathic Medicine is our sponsoring institution, and we partner with them for academics as well as administrative duties for the program directors in order to maintain the residency programs.